Before you crack or manipulate your back, make sure you don't have one of these 5 diagnoses. First is sciatica. With sciatica, it's typically caused by herniated disc putting pressure on a nerve root. If you try to manipulate this area, it can put more pressure on that nerve root, making your symptoms feel worse. Second is spondylolisthesis. With spondylolisthesis, typically one of your vertebrae is out of place a little bit. If you manipulate your back, it can cause your vertebrae to become even more out of place. Third is spinal stenosis. With stenosis is an abnormal narrowing of the spinal canal, putting pressure on your spinal cord. Manipulating this area can make your pain worse. Fourth is osteoporosis. When you have osteoporosis, your bones become weak and brittle, and manipulating them could cause a fracture. And last is rheumatoid arthritis, which is a chronic inflammatory disorder of your joints. If you try to manipulate an inflamed joint, it will make your pain feel worse.